A recent but very well-known affection is the paramyxovirosis. Paramyxovirosis in racing pigeons is caused by a variant of the pseudo-wing pest virus. The paramyxovirus is for racing pigeons the most worldwide spread virus. The symptoms of paramyxo are caused on the one side by nervous disturbances and on the other side by kidney affection. Kidney affection in pigeons causes watery droppings and an increase in water intake. The watery droppings differ clearly from the soft feces accompanying an intestinal infection. One may distinguish a little pool of water around the droppings in paramyxo, while in diarrhea the whole droppings are watery. Nervous affections then again cause vibration of the wings, incoordination of the head motions, pecking next to the grains, turning neck and sometimes paralysis of the eyelids and limbs. Both symptoms can appear independently from each other. Nervous disturbances only show up in a small number of the affected pigeons. Moreover, they are much less frequent as of today than in the first outbursts of paramyxo. Momentarily, the disease is rather exteriorized by an indefinite symptom with watery droppings alone. That often makes diagnosis more difficult. Many a fancier thinks unjustly that intestinal disturbances lie at the base of this problem. It is, however, the kidney damage caused by the paramyxovirus which is responsible for the watery droppings. A remarkable fact is that in the last few years, more paramyxo cases were established. It is not excluded that the pigeons have a lower resistance due to, among others, the frequent use of cortisones or the improper use of them. Paramyxo can be prevented in a very efficient way, namely by annually inoculating the pigeons before the racing season. Adequate protection can only be acquired by a subcutaneous injection of a DET vaccine in the region of the neck. Vaccination is possible as early as the 6th week after birth. A stronger immunity is, however, obtained when the pigeons are a few weeks older. Very important is, however, that the young born later are also vaccinated. Paramyxo is especially active in the late summer. The reason for this is that many fanciers neglected to inoculate the last born pigeons. Living vaccines brought into the drinking water or directly into the nose and eyes give insufficient protection. It would be better not to use these anymore. Once the pigeons have been affected by the paramyxovirus, there is no remedy. Supportive measures such as isolation of the sick birds and administering of electrolytes can, however, be applied. This will limit the duration of the disease.